Hello, everyone. My name is Marjan Enriquez, and I am the founder and CEO of Capsyd Biotechnology. See? Okay. We are at war, and this is no ordinary war. Our enemies are so small that we can only see them under a microscope. But they are so strong and they are getting smarter such that they can wipe us out in the next few decades. Superbugs, or antimicrobial resistant bacteria, are a growing existential threat. Just last year, 700,000 people died because of a superbug infection. And in the next 30 years, that number will grow to 10 million, according to the United Nations study. And Capsyd is perfectly positioned to solve this problem. And we will do this by using viruses. And we're not talking about COVID-19, which is something that we're familiar with, but we're talking about good viruses called phages or bacteriophages. Bacteriophages are viruses that infect bacteria, and they have been a part of a long therapeutic history. But in the past few decades, they've met so many challenges in commercial development. And Capsyd is going to lead the way in overcoming them. How do we do it? You see, phages are picky eaters. Their strength lie in their specificity, which is good because it makes them safer than antibiotics, lower risk of side effects, and has a low environmental impact, making sure that it only targets the bacteria that it's supposed to kill. E. coli phages will kill only E. coli. Salmonella phages will only kill salmonella. But this is a double-edged sword. Sometimes they can get too picky. Some E. coli phages only kill, for example, E. coli 2 or E. coli 3, but not E. coli 1. And that's a problem. This makes phage development more challenging, and it's especially more challenging when we don't find suitable phages in nature. Capsyd is here to take control of this destiny. Capsyd is here because we have the technology to diversify these phages so that we will have effective treatments and we will accelerate that process. Our first target, C. diff, or Clostridium difficile. C. diff is notoriously the #1 healthcare-associated infectious pathogen. It takes away the lives of about 15 to 20,000 Americans every year and causes pain and suffering in the form of severe diarrhea in 500,000 people here in the US. And they're notoriously hard to kill, and their phages are hard to find. So what we do here in Capsyd is to address these challenges that only specifically C. diff phages only have. You see, not all natural phages kill immediately, and that's what we need for us to have an effective treatment. We have a team of experts who are well-versed in performing genetic manipulations that will render them effective. And we also have the proprietary target diversifying technology that will broaden the range so that we will have a reliable source of treatment for these C. diff and C. diff infections and save the lives of many patients. So after we develop this, which will take a couple of years, and once we have our early clinical results, we will we are prepared to market it on a larger scale. We prepared by already developing a sound and responsible pricing model that is tied with the needs of the healthcare facilities that need our help. So 90% of the savings that they get from the use of capsid phages will be used somewhere else, and that can be quantified to $23,000 per patient, and that in turn saves healthcare dollars and saves lives. Phage therapy is the future of antibacterial treatments. It's inevitable, and we're just getting started. So if we focus on this hospital-acquired infections, and which happens to be the most notorious bacteria in the hospital, in the healthcare setting, we are perfectly positioned to expand, diversify, and possibly dominate. We have a 3-step marketing plan. We already established a vast network of scientists and phage technologists to serve as early adopters, and we will start with phage-friendly sites, translational research sites such as Yale and UCSD, and they've done a lot of phage studies in the past few years. And then we will go to our next phage-friendly adjacent universities such as Harvard, Penn, and Texas A&M. And once we have enough clinical data, and once we've shown that we have an effective solution here, we can negotiate with Medicare and private payers, and that's when we're going to implement the sustainable, reasonable pricing model that I mentioned earlier. We also have a wonderful team. My name is Marjan Enriquez again, and I am the founder and CEO. And I am supported by 2 incredible mentors, Dr. De La Fuente, who contributed to the development of the phage technology that I just referred to. And Dr. Chan has more than a decade of experience dealing with phages. As I said, phage therapy is an inevitable future. But with your support, Capsyd can be a few steps ahead when it matters the most. Thank you so much.